Hello, I'm Dr. Jill Rubinstein, and I'm a surgical oncologist with the Hartford Healthcare Cancer Institute. So I'm a surgical oncologist. I'm broadly trained in what's called in the fellowship complex general surgical oncology. My focus is going to be in the soft tissues in general, as well as in endocrine tumors, so specifically melanoma and skin cancers, soft tissue sarcomas, which are much more rare entities, and then also endocrine cancers, specifically thyroid cancers. The most compelling thing to me about becoming a doctor is the ability to form connections with people. What we have seen in recent years is a shift toward certain cancer diagnoses in a younger population. For instance, the colon cancer diagnoses are shifting to a younger population, and it's in a greater rate than one could assume is just from advanced screening practices. That's an alarming trend, and there's a lot of research going into why that might be. Are these environmental factors? Are these genetic factors? And what's propagating that? But that's a difficult question to answer that a lot of people are thinking about. I did my fellowship at Memorial Sloan Kettering. I spent the last 2 years in person at disease management teams at MSK as part of those teams. I think medicine is inherently a team sport, and no more so than in cancer care. So the concept of a disease management team or team-based care is just paramount to getting the best possible care for our patients. So when you bring that concept into, you gather all these specialists into a room, and we all review the same cases. We all bring our unique perspective to that conversation. And no one of those perspectives is more valuable than the other, but it's the synergy and the combination of all those perspectives that really, I think, brings the care up to the next level. I think the most important thing is to have an open line of communication, that a patient arrive knowing that their providers have spoken, that people take a personal interest in who this patient is and why they're being sent to you. I hope that providers understand that I strive to be just open to conversation, that I want to take great care of patients. I see every patient as an individual, not a diagnosis. That I really think this two-way communication is the most important part of building those relationships. Outside of medicine, I tend to be quite busy. I feel that I'm happiest when I stay busy. I do have 2 children. I now spend a lot of time outdoors. We do a lot of hiking, mountain biking. I've recently started road biking. Definitely with the recent challenges in travel, I definitely love to travel, but that's been more challenging. So we've translated a lot of that into being out in the woods, hiking and exploring nature.